Hello, everyone. In this revision lesson today, we'd be discussing the biochemical explanation for depressive disorder. The biochemical explanation for depressive disorder. If we have a look at the syllabus, this particular part of the syllabus comes under the unit mood or affective disorders. Here you go. The second section to this is explanation of mood or affective disorders and depressive disorders in particular. So this is what the syllabus, this is the part of the syllabus that we would be revising today. And for this revision, I have picked up a question from May June 2024, paper 3, variant 3.3, question number 2A and 2B. So initially, I'd like to start off with question number 2A, that is worth 2 marks. And remember, question number 2A always has to, always, as we have been seeing it happening in our past papers, it demands knowledge on issues and debates. So if you have a look at this question, the question over here is very typical. The question says, outline what is meant by the determinism versus free will debate. Outline what is meant by determinism versus free will debate. So again, the examiner has been very clear. You do not receive any credit for using just the terminology from the question. So you need to know more. You cannot just bluff around with the examiner. That wouldn't give you any marks. So moving on, if we talk about determinism versus free will, when we speak about determinism, or how is it that determinism is different from free will? So determinism is where behavior is caused by internal or external factors that are beyond our control. This is important over here, right? Factors that could be internal or factors that could be external that are beyond the control of an individual. On the other hand, as we talk about the term free will is the belief that our behavior is due to individual choice. Your behavior due to individual choice, and the word free will in itself explains it pretty much. And that is probably why the examiner was being a little more clear over here, that you cannot simply be using terminology from the question and expecting to be receiving marks there. You need to provide a bit more. So we just spoke about the difference between the term determinism and free will. If you want to put it together to see how you should write to be able to score 2 on 2, the extent to which human behavior is caused by internal or external factors beyond our control or due to individual choice is what this debate is all about. And of course, the first part of this question, where you talk about your behavior being determined by internal or external factors beyond your control, this is determinism. And when you talk about you as an individual having choice, this is free will. The word choice over here refers to free will. Now, taking this a little further, moving on towards question number 2B. Question number 2B over here reads, explain one strength of one strength. All right. So question number 2A asks you to explain, asks you to outline. Question number 2B asks you to explain. Explain one strength of applying the determinism side of the determinism versus free will debate. So you need to be able to, these questions, I've seen many students making mistakes over. You need to understand the question. It's good, through these revision lessons, you could actually get yourselves acclimatized with the type of questions that you receive in your CAs, which is of course going to be helpful. So you're expected to explain, number one, first checkpoint, an explanation is expected, and it should be through one strength, right? Remember, one. The examiner has even underlined the word one over here, right? So explain one strength of applying the determinism side of the determinism versus free will debate to the biological explanation for depressive disorders. Just have a look at the amount of knowledge that is required for you to be able to score these 2 marks here. Number one, you should be familiar with the biochemical explanation for depressive disorder, which is what we revise in a minute. Number two, you need to be familiar with the determinism versus free will debate. And number three, you should be able to understand the question to be able to cater to the requirements of the question and to be answering the question according to the demands of the CI. So, having a quick look at the biochemical explanation for depressive disorders. Now, if we talk about the biochemical explanations for depressive disorders, brain chemistry looks at the levels of different neurotransmitters. Neurotransmitters, what are neurotransmitters? Neurotransmitters is a substance that carries messages, that is, you could refer to it as a chemical messenger. So, brain chemistry, what does this believe in? Let me just quickly write this down. According to the biochemical explanation, an imbalance in neurotransmitters. This is considered this as the rule of thumb, right? So whenever it has to do with the the biochemical explanation, it has to do with an imbalance in the neurotransmitters. So it's the imbalance in these neurotransmitters. I did not know, I'll forget the spelling. Neurotransmitters causes mental illnesses. So this should be a catch there. So, and remember, whenever we're using the word imbalance, imbalance could be anything that is more than required or anything that is less than required. In either cases, the word imbalance is what we're referring to. So, brain chemistry looks at the levels of different neurotransmitters in the brain. Depression isn't caused by just one neurotransmitter, but by a combination of several. There are two key neurotransmitters, that is, chemical messengers, that are involved in depression. To name them, we have dopamine and serotonin. Now, when we talk about dopamine and serotonin are two key transmitters that are related to depression. When their levels drop, it can lead to the symptoms of depression, such as low mood and lack of motivation. So, we're talking about levels of dopamine and serotonin dropping down. So, if they're dropping down, remember, connect this here. This is leading to an imbalance, right? So, furthermore, antidepressants reduce symptoms of depressive disorder by increasing dopamine levels. So, to identify the problem over here was dopamine levels or serotonin levels coming down or dropping down. So, what do these antidepressants do? They try to increase the dopamine levels. Remember, we're talking about an imbalance, and when we're using antidepressants as a treatment towards depressive disorders, we are trying to increase their levels, or we're trying to uh, we're trying to increase the dopamine levels. And the idea, the philosophy over here is, by increasing dopamine levels, you would fix that imbalance and turn it into a balance. Now, furthermore, antidepressants reduce symptoms of depressive disorder by increasing dopamine levels, which support the theory that low dopamine levels were the cause of the depressive symptoms. Now, getting into a bit more of detail over here, dopamine is involved in sending signals to parts of the brain that control feelings of motivation and pleasure. If dopamine levels are low, it can lead to a lack of motivation and low pleasure, which are common symptoms of depression. For example, individuals who depress, they experience low mood and lack of motivation. There has been research that shows that people with depression often have lower dopamine levels. Hence, this is in support of the dopamine hypothesis. Again, the same thing that we've spoken about earlier, antidepressants can help by increasing dopamine levels, which reduces depressive symptoms by balancing out neurotransmitters. And what neurotransmitter? Neuro, I did that again. What neurotransmitter are we talking about? We're talking about dopamine here, right? On the other hand, if we speak about serotonin, serotonin helps control your sleep, your appetite, your mood, your anxiety. When serotonin levels are normal, mood and anxiety levels are balanced. However, when low serotonin levels can lead to low mood, anxiety, and problems with sleeping and eating. They're all common signs of depression. The most common antidepressants, such as SSRI, that is selective serotonin reuptake inhibitors. Well, how does this work? This works by increasing serotonin levels, right? So, again, remember, we spoke about a situation when your dopamine levels, when your serotonin levels were low, right? If they were low for the third time now, that creates an imbalance. Now, what you're trying to do by treatment is by using typical or atypical antidepressants or by using SSRI, that is selective serotonin reuptake inhibitors, you're trying to increase those serotonin levels. So, which work by increasing serotonin levels, hence supporting the theory that low serotonin plays a role in depression. Getting back to the question again after this quick revision, the question over here read, explain one strength of applying the deterministic side of the determinism versus free will debate to the biochemical explanation for depressive disorder, that is unipolar disorder. A quick look at the guidance before we could hop onto the points. Number one, biological explanations of depressive disorder, that is unipolar disorder, needs to be discussed. No credit for explanations of why biochemical explanation is deterministic. No credit for just identifying the stress. So it has to all be connected for you to be able to score well. So we discuss a couple of points that could possibly be used as strengths, and towards the end, we would wrap this revision lesson by reading through the example. Now, to begin with, let's read the question again. It would take a couple of seconds, but it's worth it. Explain one strength of applying the determinism side of the determinism versus free will debate to the biochemical explanation for depressive disorder, that is unipolar disorder. If we talk about the strengths over here, possible points that could be used, explanatory power. Okay, explanatory power. Deterministic explanations align with viewing psychology as a science which explains the cause of behavior. Another possible point that could be used is increases the status of psychology. Deterministic explanations establish psychology as a science that offers unbiased and objective explanation for behavior. Now, science is, of course, seen to be more valuable, holds more credibility. So the deterministic explanation, like the first point says, it pretty much aligns with viewing psychology as a science, which explains the cause of behavior. Number two, increases the status of psychology. Deterministic explanations establish psychology as science that offers unbiased and objective explanations for any particular behavior. Number three, application of psychology to everyday life. If the cause of behavior, example, low levels of serotonin in the case of depression, then the solution can be found in SSRIs. And this is the point that we had just discussed through the revision of biochemical explanation of depressive disorder. The fourth point establishes cause and effect relationship. The fifth point enables causes to be tested in laboratory experiments with good controls. Remember, there have been numerous studies that have been conducted to be able to test the efficacy of selective serotonin reuptake inhibitors. This is a treatment, rather say a biological or a biochemical treatment for individuals who have depression. Another point, it takes the blame for behavior away from the person, because remember, you're blaming biology over here, you're blaming a biochemical imbalance, you're blaming neurotransmitters. So remember, when we had said it is low levels of dopamine and or serotonin levels that lead to this imbalance which causes depression. So you're of course taking the blame for behavior away from the person. So this is something that we just discussed as well. But remember, in this specific answer, for this particular question, in this specific question, you're expected to explain one strength, okay? Now, the patient with depressive disorder will not feel blamed for the depression, as the cause of it is due to internal biochemical factors, which makes it deterministic as well. Quickly having a look at the example that would help us score 2 on 2. So you could write it in this manner. One strength is application to everyday life, as a deterministic explanation identifies the cause of behavior. Example, low levels of serotonin for depressive disorder, which can be treated. Here you go, you get the first mark. Moving on to the second one. For example, depressive disorder can be treated using selective serotonin reuptake inhibitors, which increase serotonin levels through blocking reuptake of serotonin, reuptake or reabsorption of serotonin into neurons. So I have a feeling I've explained the SSRIs in another revision lesson. I can't really recall what number it was, but I have a feeling I did do that. So I hope this has been helpful. And yeah, thank you.